Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 78-year-old man presents for a follow-up visit. 2 months ago, he was started on sertraline for major depressive disorder and has been titrated up to 100 milligrams a day. Today, his daughter reports that she cannot really evaluate if his mood has improved because he seems to have become confused. The patient's daughter reports a distinct new onset confusion and forgetfulness. The psychiatric mental health nurse practitioner considers the most likely cause of his confusion to be A. Urinary tract infection, B. Hyponatremia, C. Alzheimer's disease, or D. Depression. So this is, again, an evaluation question here. The patient is on a plan of care, and you are seeing the patient in follow-up evaluating the response to that plan of care. And so he was put on sertraline. He comes back. It's been 2 months. He's on a very reasonable dose, 100 milligrams a day, and now he's confused and forgetful. What do you consider is the most likely cause? And the answer is B, hyponatremia. Hyponatremia is a recognized adverse effect of SSRIs in older adults, and it should be a leading differential when there is a new onset cognitive change with SSRI treatment. Now, yes, there are other things here that could do this. I mean, remember, an important part of certification exam success is recognizing that very often there will be more than one answer choice that could work, that could be right, but you have to pick the best one of those provided in the context of the question. Consider all the information in the question and pick the best answer of those provided. Now, urinary tract infection can also produce an acute mental status change in an older adult. In fact, if you've ever taken any courses with me talking about the older adult in general or mental health on the older adult specifically, I'm sure you've heard me say that if you have an older adult with a new onset mental status change, one of the first things you have to do is a UA. And I'm not even suggesting that a UA is not appropriate in this patient, but as we look at the scenario as it's presented and the answer choices that are provided, hyponatremia is more likely because we know A, the older adult is more prone to hyponatremia, and B, an SSRI can lead to hyponatremia. So I'm not saying a UA isn't a UTI isn't possible. It's good number 2. But in this case, hyponatremia is the best answer of those provided. Then Alzheimer's disease. Alzheimer's disease, it is not acute in onset. It doesn't sound typical to say that, well, the patient was fine 2 months ago and then suddenly they're confused and forgetful. But that's not to say it could not be the case. Let's face it, many people with neurocognitive disorder due to Alzheimer's or any other cause of neurocognitive disorder, while the symptom presentation is usually insidious, older adults are masterful at masking those until they're not. And so there does come a time when they suddenly become apparent. So I would not say that it's absolutely out of the question that it's Alzheimer's disease. It's just much less likely. And even your final choice here, depression. We know, of course, that a depressive episode can mimic a cognitive dysfunction in an older adult. So any of these are possible, but the best answer to the question is the hyponatremia. And it's because you're looking for all the clues in the question. The question says that the patient was depressed, yes, and then he started taking an SSRI. So is it likely that the depression suddenly started causing confusion ever since he took the SSRI? Possible? Yes. Likely? No. Is it possible that he has a UTI? It's possible, but you're not hearing anything else in this question to suggest that. And we're not hearing anything else in this question to suggest an insidious Alzheimer's presentation. But we are told that he's 78 and he's been on an SSRI for 2 months. And so, typically, if something is not in the question, it's not really relevant to the answer. Look for what the question tells you and use it. And when you see an older adult who we already know is more prone to hyponatremia and a medication that is known to cause hyponatremia, if it looks like hyponatremia and smells like hyponatremia and tastes like hyponatremia, it's probably hyponatremia. So since you can only pick one answer here, that would be the best answer of those provided.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.